Hello, everybody. My name is Mike Longnecker. I work for the Healthcare Authority at the Office of Tribal Affairs. I'm a technical moderator for claims and billing issues, but I do try to help with all sorts of other issues as we go. I want to talk today about peer support services, and billing for Medicaid for these peer support services. Peer support services, they've been a billable service for Indian healthcare providers for a number of years, probably about 10 years. And these services do qualify for the all-inclusive rate, AIR, also known as the IHS encounter rate. The services can be billed directly to Washington Medicaid's computer called Provider One if the client is not enrolled in an Apple Health Medicaid managed care plan. If the client is enrolled in managed care, we will bill the managed care plan. And the nice part is we will bill the managed care plans just like we bill Provider One. We don't have to bill differently. One word of caution though, if we want to claim the encounter rate for a service, make sure that service is on your annual funding agreement with CMS. I don't get to see those annual funding agreements, but just make sure it's on there because my worry is if you don't have peer support or dental or chiropractic, whatever the service is, if you don't have that on your annual funding agreement and we're claiming the encounter rate, we might get in trouble later on. For contact information, our Office of Tribal Affairs team is all no wrong door. Absolutely no wrong door. Please reach out for help at any time. Tribal Affairs at hca.wa.gov. Any claims, billing, technical policy, any questions, please feel free to send. And we'll have myself and Stacy, who's with us, for technical assistance. And we've got some clinical folks on our team too. It's really cool. When it comes time to bill for peer support services, what we're looking at right here, this table is basically two billing guides translated into the language that I speak, and it's a language of boxes. So I've got two different billing guides, mental health and chemical dependency. It was rebranded to SUD or substance use disorder about 8 years ago. And one thing we notice is that there is no co-occurring category. It's important to keep in mind because a lot of folks that have mental health type issues also have chemical dependency issues. The two issues are often intertwined, but in Washington Medicaid, it's siloed. We are either going to have a mental health service or a chemical dependency service. And we'll define the category of the service. That's our starting point. For billing, share this with your billing folks. Here's my billing taxonomy. Has to be this variable if it's mental health part 2 or chemical dependency. Servicing NPI, that's the peer support provider. We won't add those to our claims. We'll leave it blank, but we will onboard that service, the peer support provider into Medicaid's computer. Reach out to Team Stacy and Mike. We love helping with onboarding providers. Here's our billable code. The regular rate is, I want to round off. It is $15 per 15 minutes. That sounds like $60 per hour. And it does qualify for the encounter rate if the client is a full scope covered client. And when we're billing Washington Medicaid, we do have to tell Washington Medicaid if the client is IHS eligible or if they're not IHS eligible, non-native, non-beneficiary. And the reason for this is funding sources. When we bill for an IHS eligible client, we'll claim the encounter rate, and out of that encounter rate, it is fully federally funded. If we bill for a non-beneficiary, for mental health, we will claim the encounter rate, but there's a state budget impact. Some of that money comes from the state, some comes from the feds. There's billing for mental health and chemical dependency. Siri, I kind of smiled because there's a Alexa Siri tool that a lot of people have. So when you say Siri while you're at home, it wakes up. But service encounter reporting instructions. Here's the link right here. Siri is a really valuable tool. We will never use it for billing or coding codes. We won't follow the procedure codes, but we can go to Siri and there's a wealth of information about What behaviors qualify for billing for a service? Like we can go into Siri and we will see that the peer support provider can do medication monitoring along with peer support services. They can also be part of the crisis team. So Siri's got a wealth of information. I'll go back 2 slides or 1 slide, but for billing, we will follow the provider one, the P1 billing guides. And for technical assistance, I cannot stress this enough. Reach out for help at any time. Team Stacy and Mike, we love helping with claims issues. Um, put our email address inbox back up on the screen. Have an awesome day. Reach out for help at any time.